Hi, my name is Dr. Laila Contractor. I'm a psychiatrist, and I know a lot of times veterans, by the time they've come to see me, they've had it with psychiatrists. They feel like we over-medicate, which we do. I'm here to tell you kind of a dirty little secret, which is we have very little evidence for medications helping directly with post-traumatic stress disorder. The evidence really points to very specific types of therapeutic modalities. We're having more and more research showing psychedelics actually being helpful, and again, used in a very therapeutic route. The main evidence, as I said, is for therapy. So it's so important. So some of the things I could tell you that are helpful is, one, trust yourself. And be honest with your psychiatrist or doctor. If you don't want medicines, you shouldn't have to be on them. And if you are, ask your doctor why you are on them. Like, why are they putting you? Sometimes I do have good reason, like, hey, I want to take the edge off your depression, but I'm going to tell you honestly, like, it's not going to necessarily stop the PTSD, but maybe it'll take it down a notch. So we have to have realistic expectations. Two, it's important for your family to get support. So if you're also struggling with substances, getting your loved one or partner into Al-Anon, your kids into Alateen, getting them support too, because they're not professionals. They don't know how to deal with this, and this will best help you. And part of this also goes back to allowing your loved ones to put on their oxygen, like how they tell you in the airplanes, putting their oxygen mask on first before trying to help you. But we know that that's your first line of support is your loved ones, your family members. And some of this also helps give them the education on what you're dealing with, because they don't know. They haven't gone to war. I haven't gone to war to know what you have been through. So helping your family, finding peers. I'll be honest, one of the things I think is important, and I own it, like, I have not been to war. So what is something I can do for you is help you get hooked up with a peer who understands what you've been through, so you know that you are not alone in all of this. And three, I know you don't want to hear it, but therapy. It is really hard to access therapy, and you probably feel like you've been failed. But I tell my patients, it's like dating. Like, if you don't like the first one, you've got to go to somebody else. And your psychiatrist can often help you with trying to figure out what type of therapy you need and what type of trauma work. But it's really important, at a minimum, that your therapist understands and works with people who have trauma, because at the end of the day, the best chance of you getting better is doing the trauma therapy work. Medicines, again, can help to a certain extent. And then if you are struggling with substances, getting into the right recovery group, and that's the same thing. It doesn't always have to be AA. It can be SMART. It can be Recovery Inc. There's so many different ways. Maybe your own church or faith belief has something already there in place, and you can get help there. But these are kind of the four things that I would say can be helpful.